In our final segment, we want to demonstrate some of the techniques that we've discussed in our earlier lecture, and we want to put it into an office environment. First, we will discuss and demonstrate the use of oxygen and airway management techniques. Then we will run through 2 office emergencies, keeping in mind our systematic plan of PABC, position, airway, breathing, circulation, and then OMI, oxygen, monitoring, and intervening. We will talk about proper documentation, staff assignments, and doing a 911 call. The oxygen is usually supplied in an E-cylinder. You need to turn it on first to see if there's enough oxygen in the tank. Once you get into the red section on the tank, that's less than 500 psi's, you have less than 10 minutes of oxygen at 15 liters per minute. When it's in the red or near the red, I would recommend changing the tank. In this case, I have a bag valve mask, and you can see the oxygen filling the reservoir. If you are using a nasal cannula or other device, put it up to your face to be sure that oxygen is flowing freely before placing it on the patient. Our first demonstration shows the proper placing of a nasal cannula on a patient's face. Place the cannulas in the patient's nose and leave the adjustment near the crown of the head. Leaving the adjustment high will allow it to stay on much better. Using a nasal cannula is good for minor distress situations. We usually run it at about 4 liters per minute. At 4 liters per minute, we increase the oxygen delivery to approximately 36%. That's compared to the 20% of room air. Running it at too high a flow rate can often be uncomfortable for the patient. The non-rebreathing mask is demonstrated here, and it is placed in a similar fashion as the nasal cannula. Run it at 10 to 15 liters per minute, and it will be capable of delivering 60 to 80% oxygen. This is better for distressed patients or for patients who are in a definite need of increased oxygen. The nasal hood, as used with nitrous oxide in our office, can be run at 4 to 6 liters per minute, and its capability of delivering oxygen is somewhere between the nasal cannula and the non-rebreathing mask. Remember, a patient who is conscious and speaking has an open airway, is breathing, and has a circulation. But any hint of breathing distress should be treated proactively. Get your emergency equipment, including your oxygen, take your vital signs, and prepare for intervention. Once a person becomes unresponsive, what changes in your treatment and management of the patient? A. Place the patient in the supine position with his legs elevated. B. Open the airway with a head tilt, chin lift maneuver. Use a jaw thrust if needed. C. Look, listen, and feel. D. Consider oxygen therapy. E. Monitor the patient. F. Intervene as needed. Let's go ahead to the live demonstration. Verify the patient's unresponsiveness. Place the patient in the supine position with the legs elevated. Put towels under the legs. Don't tip them back too far. Do a head tilt, chin lift maneuver, and a jaw thrust maneuver if needed to move the tongue away from the pharynx and open the airway. Oxygen therapy with the non-rebreathing mask is in place. Look, listen, and feel. Institute appropriate oxygen therapy. If the patient is breathing normally, that means that they are breathing with a rate of respirations greater than 10. There is obvious air exchange, air coming through the mouth and the chest moving, and there is good perfusion Treatment might also include using a ammonia vaporol to stimulate the patient. If the patient is unconscious and is placed in the proper position, the airway is open, receiving oxygen, you would expect a rapid response if this is a vasovagal reaction. If they do not respond rapidly, it is wise to consider another cause and consider calling 911. If respirations deteriorate, i.e., slower than 10 per minute, poor perfusion, or if there is any question whatsoever that the patient is not breathing adequately, we must help them breathe. Again, head tilt, chin lift, look, listen, and feel. Of course, if we've given any medications, we want to reverse them, and we want to help them with respirations. The best device in this armamentarium is the bag valve mask. The bag valve mask allows us to breathe or help breathe for the patient. Let's look at a few techniques that we might use. The one-hand technique, or described as a CE. This technique can be a little difficult to master, and for most of us, the two-handed technique will give us better results. One person places a hand on each side of the mask, obtains a good seal around the patient's nose and mouth, and the second person squeezes the bag. If we're not able to ventilate the patient, that is, we're not able to breathe for the patient so that we see a good rise of the chest with each breath, we might consider an oral airway. This is demonstrated here, and the sizing is shown. The airway should be approximately the length measuring from the lips to the angle of the mandible. It's important not to use too small of an airway, since this could actually push the tongue further back. The nasal airway is placed by placing it through the nares in a direction parallel to the palate. It is sized by measuring the distance from the opening of the nose to the tragus. These devices help us to get around a swollen tongue or a tongue that is just difficult to get off the pharynx when we do the head tilt, chin lift, or jaw thrust maneuver. Again, consider calling 911 if we have any trouble with ventilations and the patient does not respond rapidly. If the patient is apneic, meaning that he has no visible respirations, we must call 911 first and then check for a pulse. If no pulse, we will continue to CPR, and we'll talk about this later in our talk. If there is a pulse, we will continue rescue breathing. If for some reason you can't ventilate the patient, the most obvious reason is that a foreign object or tooth has fallen back into the oral cavity. There have been episodes of a patient dying in the dental office from gauze being pushed back into the pharynx. To dislodge the foreign object on the breathing patient, you want to perform the Heimlich maneuver as you've been instructed in your CPR class. If they are unconscious, remember to do the Heimlich maneuver by pressing down on the chest. You can sweep the mouth to remove any obvious foreign object. And the McGill forceps may be helpful in snatching any particle or tooth that has been dislodged into the pharynx. Let's do a few reenactments of two situations that could occur in our dental office. Sally is a patient who presents for extraction of tooth number 32. She had a mitral valve replaced 2 years ago and is doing well. She did not take her pre-medication and was given 2 grams of amoxicillin in our office. Sally, are you feeling itchy? Have you ever had problems with penicillin in the past? It appears that you are having an allergic reaction. Assistant number 1, please put monitors on the patient and check her vital signs and keep record of the events. Assistant number 2, please get the treatment cart with the oxygen and place the oxygen on the patient. Are you comfortable or experiencing any breathing problems? Let the family know that she's having some itching and a reaction to the medication, and we're going to be treating that. Her blood pressure and pulse and respirations seem to be normal. Let me check my cheater book. The book says to draw up 50 milligrams of Benadryl for IM injection. Show me the medication to be sure that we are drawing the proper medication and dosage. I will inject 50 milligrams of Benadryl IM in the right deltoid muscle. Let's do my PABCs again. She's conscious, but she's not breathing well. She seems to be struggling, and I hear some wheezing. It appears that she's having an anaphylactic reaction. Assistant number 2, please give me the adult EpiPen, and please call 911. I will inject 0.3 milligrams of epinephrine in the right thigh.
This is Jane from Dr. Latanzi's office at 700 West Pike Street in Clarksburg, West Virginia. Sally Smith has just suffered an apparent anaphylactic reaction to penicillin. She is conscious and breathing with wheezing. Please come immediately. She's been given Benadryl 50 milligrams IM, and we have just administered epinephrine 0.3 milligrams IM via an EpiPen. Someone will meet you at the side door on Sycamore Street, and I will stay on the line for any questions.
How are you feeling, Sally? Are you feeling a little bit better now and breathing better? Mr. Williams had a coronary stent placement last year and says that he is doing well. He lists his medicines as propranolol, nitroglycerin, and aspirin. We are planning to place a dental implant in the number 5 site. What questions might you ask, and what precautions might you take prior to beginning the procedure? Well, I didn't do any of these things. I injected him with local anesthetic. I used 3 carpules of lidocaine, 2%, 1 to 100,000 epinephrine. And after the palatal injection, he began to complain. Mr. Williams, are you feeling Uncomfortable? Is your chest bothering you? Are you having chest pain? Is this the type of chest pain that you often get? Is this the type of chest pain that you get when you're working in the garden? I am also going to let the patient's family know that he is having chest pain and that we are beginning treatment. This appears to be stable angina. Let's institute our PABCs. Are you comfortable, Mr. Williams? Are you having any difficulty breathing? Well, let's go ahead and get the monitors on Mr. Williams, and let's get the treatment equipment. Mr. Williams' blood pressure seems to be high, and he is breathing rapidly. It appears that he's doing this because he is under a bit of stress. Make sure the oxygen is adjusted properly. We've put the oxygen on Mr. Williams. Let's go ahead and give him an aspirin, 325 milligrams. Mr. Williams, are you allergic to aspirin? Let's go ahead and use 1 pump of the nitroglycerin spray on his tongue. You seem to be much more uncomfortable, Mr. Williams. Is the pain more intense? Well, let's go ahead and call 911. I believe he is experiencing unstable angina, and I am very concerned that this may be a possible myocardial infarction.
This is Josephine from Dr. Latanzi's office at 700 West Pike Street in Clarksburg, West Virginia. We have a patient, Frank Williams, and he's collapsed and he's had a possible MI. CPR is in progress and an AED is being set up. He initially complained of chest pain and was given nitroglycerin and aspirin, oxygen, but he collapsed at 9:30. Please come immediately and come to the side door on Sycamore Street. Someone will meet you there, and I will stay on the line.
We've switched to the mannequin to demonstrate CPR. We have one group managing the airway with the bag valve mask. We highly recommend the two-handed technique with an extra person squeezing the bag. We want to do chest compressions at the rate of 100 per minute, and we want to do compressions at a rate of 30 per every 2 breaths. Let's also set up the AED. You can see the difficulty that we're having doing CPR in the dental chair. It worked very well to have someone stand on the base of the chair, and we were able to accomplish much superior CPR. Also, our people were a little crowded in the back. It might be beneficial to move your chair or turn your chair so that the people are able to do a satisfactory job with the oxygenation. When we set up the AED, be sure to have good visualization of the chest and wipe it off. Do not use alcohol since it's flammable. Do not have any free-flowing oxygen over the area where the defibrillation is taking place. Do not use the AED designated for adults on children age 8 and under unless pediatric pads are not available. Do not use the AED on a person wearing nitroglycerin patches or other patches. Remove those patches with a gloved hand prior to placement of the AED pads. Keep mobile phones away from the AED since they may interrupt the analysis. If the patient has a ICD or a defibrillator type device, place the pads 1 inch below the device. If the person has a hairy chest, take an extra pair of pads and place them on the victim, press down and pull it off, or you can simply shave the area. If the person is wearing an underwire bra, please cut it off. The EMTs are arriving. We will give them a full report and have the records available for them.